We will continue discussing the points of the primary channel of the large intestine. Okay, for general location, the course of the line connecting LI5 and LI11, which is 12 soon, changes depending on whether the forearm is in a supinated or a pronated position. For location purposes, the forearm should be in a mid position with the elbow slightly flexed. Since the LI channel crosses to the opposite side of the body at DU26, at the nasolabial groove, locate LI19 and LI20 contralaterally. The LI channel of the hand Yangming is exteriorly coupled with the lung channel of hand Tai Yin and paired with the stomach channel of foot Yangming according to six-channel theory. The large intestine-lung relationship is further strengthened by the fact that both the interior pathway of the large intestine channel as well as the large intestine divergent channel enter the lung zan. The large intestine luo connecting channel from LI6 joins with the lung channel. In addition, it is clinically valuable to note that the large intestine primary channel enters the gums of the lower teeth. The LI primary channel crosses to the contralateral side of the face at DU26. The LI sinew channel ascends to the corner of the forehead and crosses over the top of the head to connect with the opposite mandible. The LI luo connecting channel enters the ear as well as the teeth. The LI divergent channel descends to the breast. The LI sinew channel attaches to the upper thoracic spine, and the divergent channel travels medially to the spinal column. The function of the LI fu is to receive waste material sent down from the small intestine, absorb its fluid content, and form the remainder into feces to be excreted. Despite this, although several points of the LI channel have an action on the intestines and lower abdomen, particularly in the treatment of borborygmus and diarrhea, in clinical practice, they are considerably less used than points of the spleen and stomach channels. Also, there is no LI channel point indicated for difficult defecation or constipation. This paucity of LI indications is not surprising in view of the fact that whilst the channel traverses the upper body, the fu lies in the lower abdomen. According to the spiritual pivot, Yangming channel is abundant in qi and blood. Points of both the arm and leg portions of Yangming channel are therefore much used clinically to regulate qi and blood in the limbs and treat atrophy disorder and painful obstruction, hemiplegia, and pain of all kinds. In the Chinese tradition, the sage faces south, and thus the light and warmth of the sun fall on the front of the body. The Yangming channels on the anterior of the limbs receive the full intensity of the sun, as does the abdominal and chest portion of the foot Yangming stomach channel, the only Yang channel to run along the anterior of the body. For this reason, Yangming or Yang brightness is considered to be particularly replete with Yang qi. Points of the LI channel, therefore, are among the most important points to clear excess of yang in the form of heat and fever, notably LI4 and LI11. Apart from the ones mentioned, the primary actions and indications of the points of the LI channel can be summarized as treating all disorders of the Yangming channel in the head. This area includes the face and cheeks, forehead, eyes, nose, lips, gums, and teeth. Treating disorders of the ear via the LI luo connecting channel. Expelling wind, cold, and heat from the exterior portion of the body. Clearing wind heat, interior heat, and fire poison from the areas traversed by the channel, especially in the head. Clearing Yangming fire, which disturbs the heart and spirit, assisting the lung in its function of opening the water passages. So finally, we have the target areas of the large intestine channel.